Welcome to my channel once again, and today we are going to look at the section 2 of intravenous fluids, specifically on crystalloids. The main focus for today is going to be the hypotonic and hypertonic intravenous crystalloid fluids. So let's begin. What is the hypotonic crystalloid IV fluids? So these fluids have a lower osmolality than plasma, causing water to move from the bloodstream into the cell. So technically, these fluids has a solute concentration that is very low, making it possible for the concentration inside the cell to be higher. So it pulls water from the bloodstream into the cell, and then this can cause the cell to swell. So this is a simple reminder: cells swell when it comes to hypotonic crystalloid fluids. So let's look at some common hypotonic crystalloid IV fluids used in the nursing or medical setting. So we have 0.5% normal saline. Previously in isotonic we had 0.9% normal saline being isotonic, but in hypotonic 0.5% NS is hypotonic, as well as 0.33% normal saline. Then we have 2.5% dextrose in water. Look at the effects of the hypotonic crystalloid IV fluids in the body. So we have the first one being it being able to move fluid into cells, as we explained earlier, because the solute concentration inside this fluid is less as compared to that in the cell, therefore causing a flow of fluid from the intravascular plane into the cell. Then we have it decreases intravascular volume. Why? Because there is movement of fluid from the intravascular compartment into the intracellular compartment. Then we have rehydrate cellular component. Yes, still a build up from the top. So once fluid moves from the intravascular component or compartment into the cell, it rehydrates the cells. Common uses. Common uses. So mostly used in cellular dehydration when there is loss of water in the intracellular compartment. This is given to allow water to move back and hydrate the intracellular compartment. Then we have hypernatremia, where there is a lot of sodium in blood above normal range. So this increases the concentration of sodium in blood, allowing cell dehydration. So fluid will move from the intracellular into the intravascular, making it more difficult at this point in time for the cells to get hydrated. So this goes in there and reverse the process by diluting the sodium as well as rehydrating the cells. So next is consideration. So normally this hypertonic solution will risk a patient for cerebral edema, and then it should be avoided in head injury and stroke. All these points pose or point towards the ability of the fluid to move from intravascular to intracellular. So at this point in time, more fluid will move in there and cause the cells to swell, thereby increasing intracranial pressure. So it's mostly avoided because of the movement of more fluid into the cells of the brain as well. You need to monitor for blood pressure and mental status, because more fluid are moving from the intravascular plane or component or compartment into intracellular, so there might be decreased in blood volume, thereby causing hypotension at that point in time. So there's a need to monitor for blood pressure and then mental status. Look at the hypertonic crystalloid fluids. So this fluid have a higher osmolality than plasma, causing water to move out of the cell into the bloodstream. So simple term, in the cell shrinks because fluids are forced out of the cell back into the bloodstreams. One example of the hypertonic crystalloid fluids is 3% normal saline, 5% normal saline, destro 5% in normal saline, and destro 10% in water. Their effect includes they push water from cells into circulation as explained earlier. They expand intravascular volume because they push water from the intracellular compartment into the intravascular compartment. Then we have it reduce cerebral edema because of the same function above. Then we have other common uses. So mostly they are used in severe hyponatremia because most of the hypertonic solution contains sodium at higher percentage. So they go in there and they replace the amount of sodium lost in the intravascular compartment. And then during cerebral edema, they are given, and as explained above, they pull water from cells back into the intravascular compartment. Then increased intracranial pressure, meaning at that point in time, cerebral edema causes an increase in intracranial pressure. So when it reduces that, intracranial pressure decreases. There is high risk of fluid overload because now fluid are going to move from the intracellular to the intravascular compartment. So there's a need to monitor for fluid overload, and then you have to give this slowly. And normally it's given through the central line, but peripheral IV lines are also used. Need to monitor serum electrolytes because this has a lot of solutes in high concentrations, so it's going to increase serum electrolyte levels. So you need to monitor for changes. Time until we meet again to discuss further presentations on the same topic.